Right, so welcome.
How are you today?
All right, my lovely, so let's get that in there. Okay. Congestion around your thoracic spine, so the middle of your spine. Just going to hold your stress points just for a moment, and I'm going to place my hand over your heart. So today I chose, I think the same as before, it was the tea tree and mint. So
yeah.
There we go, my lovely.
Thank you so much.
Right, so welcome.
How are you today? I'm good, how are you?
Good, thanks. Right, so this is exciting now because like I was saying earlier, like everyone's in a sense following your journey now, isn't it? So we got spirit there now, isn't it? We're going to sort of invest in, like I said to you last time, about maybe 6 weeks or so if you're happy to come.
Absolutely.
If you're not jet setting and traveling.
No.
Be very interesting just to see how we can progress with these sessions. So I want to focus on reflexology just because there was a lot of imbalance.
Yep.
Yes?
Yep.
Yes, we agree?
I agree.
And almost it would be nice to hear from you as well what that might be. Like if you feel something's different, or something was at like say a 7 out of 10 pain, but I go over the same area. Maybe it's like a 3 or 4, or maybe a 9 or a 10, I don't know. But just to sort of experience what that is showing up. All right, so intuitively I picked 3 flowers today. Anything you want to confess?
No, not that I'm aware of.
Right, so what did I pick up? Decision making.
Oh, interesting.
Yeah, so just clarity, almost like I say, the fork in the road, and just what left, what right. And I guess that's coming in with changing career, things like that. The endurance vial, so maybe just pushing yourself beyond limits, or sort of understanding you're going through a lot at the moment.
That's,
And patience.
Oh, right. I need patience.
We all do. All right, my lovely, so let's get that in there. Okay.
Wow.
Don't know about that sound. So just switching gears, finding that moment of stillness when we walk in here. I see your digestion's going already. That's good. So just placing your hands at the side, just so I can connect with your belly. Nice and warm here. Are you hot? Oh, it's very warm here. I never touch a belly this warm.
Not really?
Yeah. It's nice. It's like
comforting.
Yeah, I don't know what you call it, like a hot water bottle. Are you happy to have the blanket as well still?
Yeah.
Yeah, I'll get that for you in a moment. So let's just tune into your breath. So I'm placing ever so slightly some pressure. So when you breathe in through the belly, you can just really expand the belly, raising my hand. And out. So the news about the doctor was a bit stressful, I think. And again. Got something in the roof as well going with us, isn't it? I don't know what that is. And last one for me, nice deep breath in. Okay, so just tuning into that while I get the blankie for you. Move my maracas. You know what it feels like? It feels like some energy needs to shift today. I feel like there's something you're holding on to.
Like what? Maybe that's why my eye's tearing.
You just sit here and tears fall out your face.
Yeah.
I love it. I'm that good. Could be. I mean, like I say, it's a space to release. Maybe I can do a couple of air acupuncture release points if you're down for that.
Yeah, absolutely.
I'm getting good now, like doing 10 to 12 treatments in 1 hour with people, so
That's really good.
I got the Neurosim for the clinic now. This is so cute. Got the Neurosim for the clinic now, so I've just been guinea pigging a few people with it during the colonic, and very impressive, I think.
That's good. I've been using mine on and off. Not as interestingly, actually, have been using my grounding mat more.
You should use it every day. It's permanently on my bed, the grounding sheet and mat. 1, 2, 3. Stress point. 1, 2, 3. Sorry.
That's okay.
You need it, right? 1, 2. I'm going to go for, let's go the parasympathetic. 1, 2, 3.
Oh, the goosebumps. Ow. Sorry, it's not you.
1, 2, 3. Okay, I'm going to do a heart point as well now. 1, 2, 3. And what I'm going to do is actually mimic it on the other side as well.
Oh, just never done this before.
Oh, only because on the colonic, I don't want you to lay on it.
That's true.
1, 2, 3. Okay, sorry, I tried to warn you.
That's okay.
Actually, it's very interesting. There's a lot of congestion around your thoracic spine, so the middle of your spine.
Right.
Are you having back pain?
No.
Guessing, not sure if it's factual, but 1, 2, 3, maybe your fluid is not flowing very well, the cerebral spinal fluid.
You know why? Maybe. I don't know if it has anything to do with it. What he was saying is when my...
Very interesting story. I'm joking. Sorry, I know. I'm inflicting pain, but
That's okay.
Wait, 1, 2, 3. I suppose because I'm going for the sweet spots. And then I'm just going to do the last one for your heart point. 1, 2, 3. Actually, I'm going to do one more for circulation. 1, 2, 3. Yeah, I know. I go straight to the sweet spots, isn't it? And 1, 2, 3.
That one was fine. Weird.
So more imbalance on the left side. But like I say, I notice exactly on the left ear there's something going on there. Which is super interesting.
The scar tissue, what he said he saw on my CT scan to check where the blood was flowing from my clot, was the scar tissue is actually compressing on the spinal region.
Okay, so I can see that.
So that's probably why that came up.
So you need to go to Ian.
Yeah.
Pronto.
On my list. On my list of things to do. Thanks, Doc.
It's just how I find is when a third party tells you to do something, all of a sudden it just jumps to the top of the list, isn't it? Right. Gonna do this?
Yeah.
We're gonna engage.
See, I'm still crying.
Do you want me to not put on?
No, it's fine.
Do you want me to pat your eye?
No, it's fine.
Should I bring some
It's
tissues?
just very weird. No, it's okay.
Yeah. Well, you know what I realise for me, because especially when I do plant medicines, it's like you feel so normal, but stuff is just falling out.
Yeah.
Your body's processing, so just allow it to happen.
Thank you. Yeah.
Okay. Just release. I can feel. Like I said, I can feel it. It's giving me heebie-jeebies.
Sorry.
Don't be sorry. Where else are you gonna let it go?
Yeah, this is true.
So if this is the place and the space, I am very humbled and honoured, right? Just going to hold your stress points just for a moment, and I'm going to place my hand over your heart. Just breathe into it. And knowing you're in a safe space, and that you have permission to let go. Trust your body's processes. Because the more you let go, the more you heal. Just moving my hand to the top of your belly. And just inviting you again, nice deep breaths to the belly. And letting it out. Finding your center, finding your grounding. Okay. Beautiful. This is called Agua de Florida. Just to clear some energy. So it's a very nice clearing yet uplifting frequency. So I'm just going to make contact with your feet here just to feel, because last time your feet were very cold when we started, but actually they feel quite good for this moment. This one's nice and warm, but I think that's because of the red light. We'll take it. Okay. So today I chose, I think the same as before, it was the tea tree and mint. So
yeah.
I chose that intuitively. So that for me again, I get this impression of like lovely tingles. Sort of opening up the flow of energy as well. So yeah, I'm excited to see how we can work this over sort of a 6-week period and just see what shows up and what changes.
Yeah.
But definitely, like I say, I see in the spine. What's very interesting is the spinal fluid, the cerebral spinal fluid. It's 90% water. So of course, a clot, for example, just means there's dehydration. Right, things are a bit, the viscosity of the blood's a bit thick, gets stuck, and so maybe there needs to have some more fluids, or like colonics, drips, juices, soups, smoothies, electrolytes, that kind of thing, which I'm sure you're doing. So you just need to do, and then obviously as you're saying the word compression, I think that's where Ian can step in for you. And
yes, absolutely.
You know, do his magic, really. And maybe you can just go down there for the day, be by the beach, because you can get some really good air as well. Have a little day off.
Yeah. It's funny though that come up for you, and he, like the surgeon only just mentioned it to me yesterday.
And see, the thing is, what I spend my life doing is I literally study that I can be a creepo, that when I look at you, I can go, you have this problem in your body. And sometimes it's psychic as well, and then sometimes it's literally obvious, you know. It's when people mock Eastern medicine, I'm like, yeah, but Western medicine is framed about 800 years, but Eastern medicine's 5,000 years. Like, if I had to say to you, which medical system would you prefer? Something that's 5,000 years old or something that's 800 years old? It's like a no-brainer, right?
Absolutely.
And yet people are very mean about Asian medicine. And I'm just like,
I think, no, it's incredible.
Yeah. And I always say there's always an answer, there's always a treatment. It's just you might not have found the person who knows how to treat it, or the therapy. Right, so it's kind of like a continuous game about finding new things, a continuous curiosity about constantly trying things, because doors will open, you know. Yeah, like I said, in that dream state I had with you about dissolving it. It's a very weird thing, but I got in my head bicarbonate of soda, and I was like, oh yeah, almost like I got this, maybe it's the energy of it, but I was like putting bicarb of soda in your body, and I just saw this clot dissolving, you know?
Wow.
And I was like, how can you do that in real life?
Yeah, I mean, that would be amazing. That was so bizarre, because I have, ever since I had my last treatment with you.
This one?
Yeah.
Oh, yeah.
My sleep, using like the grounding mat and whatnot, like I've just been sleeping like an absolute baby.
Oh, lovely.
And the night that, well, you messaged me the next day, and that night I had the worst sleep of my life.
All right.
Well, my life in like the sense of
since in my last life treatment. The whole week that I can remember. Yeah.
So I wonder if I like was picking up on that.
Probably.
Yeah.
Because if anything, Which I guess you'd frame in a sense of like psychic surgery, right?
Yeah.
It's an uncomfortable thing. So yeah. I just at a point in my work now, I just share with people because like you say like, oh, that's really interesting because this has happened and that's happened, and you know, just seeing where it comes to. Because I have seen with my teachers like miracles literally performed right there. I'll never get over when I was at my Tibetan medicine course. This woman had fibroids so massive she looked like she was pregnant, and he literally did a psychic surgery on her. Is that okay?
Yeah.
Yeah, just a bit of a twitch there. In front of our eyes, her stomach literally halved. Like, you know, and you just, that is literally magic.
That's incredible, wow.
You know, and I've just had enough experience to go, actually, like, I believe because I've seen, right?
Yeah.
So everyone thinks like, oh, I'm just airy-fairy, and I'm like, no, like, I'm very logical and science-backed, but I've seen, right? I haven't been hoodwinked.
No.
All right, so this is quite good. So now we begin, but we will talk anyway. I like chatting too. It's nice.
Yeah, it is nice, isn't it?
Tests me out. I can multitask as well.
I shall not distract. Although I do have a question for you.
Yes, okay.
What you were saying about the dehydration with the
Spinal fluid.
and whatnot, what impact does that have on your stomach?
No, a complete knock-on effect,
Yeah.
because basically the spinal fluid's connecting your whole body to your brain, and if information's not being able to go to your brain, then it can't tell the body to do different things, which there might be sleep, repair, digest, rest, function, think. Oh, here.
Yeah, I can feel that.
That's the back of your neck, your occipital specifically. That I don't remember last time.
No,
I
was going to pull that up as something that's different.
Well, very interesting timing, tying in with what we're literally talking about, is when the fluid can get stuck. It's that little like basin behind the neck, the occipitals. There's two little bones at the back. So that's where usually it can get stuck. So that's showing up. I don't know if I've ever shown you pulling on the ears. It's called unfurling. I'll show you after. But that's really important to do. Something you can do at home, 30 seconds a day, if not more. Kind of, it's a borderline between pain and pleasure, where you're pulling on the ears, releasing the ears.
Yeah.
I get the impression you'll like it.
Probably.
You're like, that's nice, pull on my ears. Well, we can do an ear treatment next time as well. Maybe we can do a 2-in-1. I can do some seeds, so that can sort of stay with you for a few days as well. On top of after this, we can maybe do 2 treatments in one, especially before you start your new jobby.
Yes.
Anything different from our last session? Maybe changes. So you just said the grounding mat, sleeping different.
Sleeping different. Grounding mat. Probably more like getting back into, I guess, kind of like what you were saying, like, you know, knowing the things that you need to do for you to heal yourself. So more of a like conscious decision to do all the things that I should be doing.
Yeah, like I was just saying, when a third party tells you to do it, all of a sudden you do it, right? I don't know why that happens, but it is what it is.
Plus, obviously, I think like too at the moment, like it is like a bit scary just with everything with my leg and whatnot. So
of course,
you just like, okay, well, what can I do? Which probably like is like I can't remember what plant came up, but like patient, and I think one of the other ones was endurance, like don't push yourself.
Yeah.
So that kind of makes sense.
Yeah, it's almost actually, I would say, when it comes out, I always like to say the positive side, but I was like, makes nicer sense. But it's kind of like you have a limit, and you're already past that limit. Yeah. So, I guess that timing-wise, it's coming up to the full moon. You've just changed jobbies. Oh yeah, because we're doing the sound healing, isn't it? It's separately.
Yeah, we are on Saturday.
Yeah, sorry. Next time we do it together.
Yes, absolutely. And her bowls will be fully charged.
Yes, she sent me some snippets actually of her. She's an older woman, but she dresses so beautifully and so elegantly. Like she almost shapeshifts into you. Like she looks 20 actually.
Wow.
You'll see what I mean.
God.
And then she told me that the first time she started get here, what's this here? Lungs. Yeah, so not enough oxygen. Breath work, but we talked about that on the phone.
Which is also like funny because there was well, I've registered for those Saturday breathwork ones,
Mm-hmm.
and then had like months and months ago scheduled in like a call with this breathwork person.
Mm-hmm.
And anyway, she's doing a workshop on Sunday, which is obviously the day of the eclipse.
Mm.
So I'm going to go along to that and give it a go.
Mm.
See if that will help.
Definitely will.
But I've never really done breathwork before.
Can be quite challenging, but rewarding, and also I like that it's a natural thing. I only got into it because I was stuck in the jungle doing plant medicines during COVID, and then one day I was skipping at the river, as weird as it is, and then I was completely isolated for 6 weeks. I always say this is a very rare experience that probably any human will ever have in their life. I was completely alone for 6 weeks.
Sounds incredible.
I'd say as a healer, it really taught me a profound understanding of what is my own energy.
Mm-hmm.
And when I work with other people's energies, oh la la, your knee here, then I can actually now understand the separation between what is mine and what's other people's stuff.
Yeah.
So a really powerful life lesson. But I was skipping, and because I was at the height of just being completely in the zone, psychic, like on medicine, in the jungle, eating almost nothing, so in a very fasted state. And then the medicine spoke to me and just said, "We're done with you now." And I was like, very vulnerable, attached child. I was like, "What?" So you've changed my life? Like what? Like what will I do? Like who will give me direction? I felt very like scared in that moment. And they said, "Now we've taught you what it's like to connect. You need to find natural ways to do it now, because plant medicine is very hard on the body, right?
Yeah.
Not everyone can have it for a sustained period of time." And I said, "Well, that makes sense, because it is quite hard. I could feel like it hurting my kidneys and things like that."
Oh, wow.
But it is something people should definitely try, but only with a regarded healer. And then I was like, okay, well, like they said, you need to find natural ways to do this. And I was like, what do I do? What do I do? And they just said, start with breath work. So when I got repatriated out, I got flown out by the military.
What?
On a flight full of nurses, which I was terrified, because I was like, aren't they having all this COVID around it? And then, then like the flight attendants were military men. It was really hilarious, actually.
Wow.
Like, weird life story. I've got a picture
What
of
an
it.
experience.
Then I just went online, and then this is like a shamanic teacher working, I don't know if still, with another teacher who's more into like SE, like somatic experiencing therapy. And I did a course for a year, and it's really powerful. And you really do want to step out of the process and not really do the work.
Yeah.
It's very easy to have a form of escapism, disassociating, because it's too hard to deal with it. Because when you breathe, you have to be present, and then that means you have to come back into your body and deal with what you've been avoiding. Right?
Yeah.
Not everyone can do that, and so not everyone finishes the course or the treatments. But what I like about it, it's a very powerful grounding tool. So, you can be anywhere in the world, you can be stressed, you can be at work, you can be triggered, and you just have a tool that you can immediately have at your hands, right?
Yeah.
And it's boomed. I mean, I studied that, I think, 2020, I studied that 2021. So it's been a number of years I've done it. But
Wow.
And now it's, over the last year or so, now it's booming. And
It is, isn't it?
And I love the fact that it's like science-backed, and now people that would never look into this kind of work are like, oh, breathwork's normal. I'm like, well, yeah, it's like a literal basic function. Right? Yeah, it's not a woo-woo thing, is it? No, it doesn't make sense.
Oh my God.
So that meditation is now considered normal, and even Reiki is starting to be normalized. So I like it. So you know, these natural modalities are starting to really infiltrate the system. But like I say, like what I'm trying to help people do is find tools. Like, what can you have that's inexpensive and immediately accessible? And I think breath is one of those. And you'll get lots of different breath work. Yeah, this is your hormones.
That's worse than last week.
Yeah, I can feel that actually. That's like a lot. This is also in acupuncture kidneys swelling. So kidneys filter blood, filter fluids, water. That's just rub.
That's a 10 out of 10. Sorry. That's not your fault. But in comparison to...
Yeah. It's like a growth actually. It's not, but it feels like it's like a sack of fluids here. We can do acupuncture on you next. Strengthen your kidneys and your heart. Where are you at in your cycle?
Day 11 or 12.
Okay, so really not new.
No.
Okay, interesting information. So yeah. So even getting a double whammy, you're going to get sound heal. Then you can do the breath work this Saturday, then go for your sound.
Exactly.
And then do another, I guess it's going to be like a breathwork sandwich. It'll be powerful because also just like now you're coming into this room, your body's ready to purge.
It is.
So I think that'll be really good. Okay, so I'm going to work shortly on thy spine.
Yeah.
So you can tell me how juicy it is. So if I'm just going around the spine here and up, where I would say, where in your ear it showed me your problem, I would say it's about here.
Oh yeah, that hurts.
Number?
Yeah.
Out of 10?
Oh, sorry, 6, 7.
What's your security code?
Wow, that escalated.
Give me your password. Right, and what about here? A bit less.
That's not as bad as the top, to be fair.
And then up here?
Yeah, that's about a 7.5 to 8.
Okay.
Not as bad as the kidney section though.
No.
The one thing I do notice differently from the first time versus now is I can feel it more in my body opposed to just the pain on my feet.
Oh, so you can feel like where it relates, yeah?
Where it what, sorry?
Where it's relating to.
Yeah.
Like, that's great. That's a superpower in itself. Where are you feeling?
So at the moment, I don't know if it's correlating with, but it's all the way down and it's actually only on my left side.
Yeah. Well, that is where the imbalance is, right?
Yeah.
What are you feeling in the left side?
It's just a dull pain.
Where is it starting? Where is it ending?
So
if I'm a blind person, where is this dull pain?
in that, like the mid-thoracic spine area.
Okay. So we need the fluids to move. It's almost nice to know that we have a localized area that we can work with, right? I must say your foot is much better. Last time it was crunchy, you'd make crunch with peanut butter everywhere. Every bite gives you another crunch, but it's really good today. There's obviously, this is now localized more so, but compared to the entire foot, and I've gone through quite a lot, I don't feel...
I'm surprised nothing's come up for my digestion.
Yeah, there's still another foot to go, right?
Oh yeah, that's true.
Only halfway, my dear. Pardon. Okay. So interesting, you can feel this crunch,
Yeah, I can.
here. So this is all urethra bladder. So this is kidney. Kidney, bladder are married in Chinese medicine. And so what you process through the kidney will come out through the bladder, right?
Yeah.
So there is definitely, sort of if we go through the whole system in that way, there is definitely from A to Z something going on. I mean, are you going to the toilet a lot in terms of peeing, or is it...
I go I don't know, once every hour.
Yeah, so your body's trying to release something, but it can't, right? You need to up the electrolytes as well. Are you doing that?
I've got my, the one that you gave me. Oh, go back down. No, across.
Oh, here. Liver. Okay, definitely. Colonics next.
Yeah, I told you.
We'll do like a 3-hour session. We'll do a colonic, we'll do this, we'll do some ear treatments.
Yeah, the one that you recommended. Celtic salt, not so much at the moment. That's only because I ran out.
That's okay. I like the electrolytes more than... The Celtic salt is just like a... I'm going to use the word like a cheap way to get the minerals in, but electrolytes have a component of multiple stuff, and I think also nice flavouring, because to have salty water is not very delicious.
No, but I do love salt.
Which is all kidney stuff, right? If you crave salt, that's kidneys. If you crave sweet, that's stomach, pancreas, spleen.
Ew.
Yeah, so basically the organs are a colour, a shape, a size. In Taoist stuff, they have like animal guardians. They have a season, a direction. They have a taste. They have a sense. They have a planet. It's
Jeez, I didn't know that.
bloody complicated. So yeah, that's why when I ask people weird questions, they're like, where the hell is that coming from? And you're like, okay. Was it sore up here?
Not up there, only on the front.
This. Okay, your toesies are still warm, so we'll
That's
see.
good.
After, just lift your foot for me, my darling, just so I can wrap that up. Okay, this is quite good today, actually. So the blood flow is quite nice. I mean, the circulation. Oh, obviously, I've done that bloody acupuncture. All makes sense. All right, so just remind me to do acupuncture next time, because I don't actually do that with people during this session, because it sometimes is a bit intense.
But it obviously works.
Well, that's what it is. Just for you, it's the right thing, right? But we needed the previous session to understand more what we need. And here, that thing is not. Yeah, a little bit. But
Not as bad, nowhere near.
3 or 4?
Like, well, I'd say, yeah, 2 to 3.
Okay.
So bizarre.
Well, I always say that we could like slice our body in half, and it would just be like 2 separate things.
Because it's so imbalanced?
Well, we're just not the same. So some organs are on one side of the body, some are on the other.
That's true.
In chiropractics, there's always this thing called contralateral. So like one problem on the left side will reflect in the right side of the body.
Yeah.
It's really complicated, actually. And then shamanically or energetically, the left side represents the femininity, the right side the masculinity. So, you know, we say, is there an imbalance in the feminine? You know, maybe there is, actually.
Possibly.
Yeah, I'm just thinking about, especially as a career woman, we're like striving to be very, and because masculine represents, oh here, action. This is eyes. Eyes? Anything with your eyes?
No, I mean the fact that they were tearing. But eyes came up last time.
Yeah. That I do remember, actually. Oh, there. Heart. Heart space. Obviously something to do with blood, fire, isn't it?
Yeah.
That's quite good. Actually, much better. So I'd like to say I think the last session's done something. It's definitely moved some stuff, because last time, like I said, it was pretty much all over. And now it seems actually more isolated, localized.
I would say the swelling's been better, like more manageable too, like on a daily basis.
All right, have you measured it? I remember you said 7 centimeters.
I haven't measured, but I haven't really had to get my my sexy little compression stockings out.
Maybe you should still wear it here.
Oh yeah, that's tight.
This is over the cardiac region, but again, it makes sense. Ooh, let that out,
my
let
God.
that out. Yeah, let it out.
Sorry.
No, let it out. That's a shift in energy.
That came from nowhere.
Or did it? The healing happens in strange ways.
Now I've lost my train of thought.
It's fine. Yeah, we need to do acupuncture on you as well, like a formula.
What's more effective? Or do they do different things?
All the different things.
Yeah.
I think one of my, I'm going to say, unique selling points is that I can do them all together.
Yeah.
It's,
I'd attest to that.
it's an auditing thing where it's completeness. In order to get an answer, how many ways can we get there? Oh, here, sorry.
That's okay.
That's your spine. It was on your left side.
Yeah.
Number?
No, that's fine now. Not like the first time you
This is hardcore reflexology. It's supposed to be relaxing, but this is medicine. Gotta work for it, honey. Just breathe into that. Magnesium twice a day? Are you taking that twice a day?
not twice a day. I've only got it
Okay, I just got that in my mind. Twice a day.
2 at night.
2 in the morning, 2 at night.
Okay. Of the normal one I take,
the magnesium glycinate.
Yeah.
Would you be able to go down to Ian as soon as possible?
I know, I'm thinking I could maybe go do him, not go do him, but go
Highest compliment,
yeah. Oh dear.
Actually, I saw him, when did I do it? For 2 weekends ago to do the cranial sacral training with him, with the chiropractic twist. It was very powerful, as I was saying to you, but I saw him say shock because I was like, oh, I tell people you're like my work dad. And I think in his head he was like, God, am I old?
Oh.
Like almost, I guess, because, as I've gotten older, I don't think of, what's it called? I don't think of, like, age, right? I don't think I'm,
I know
like,
what you mean.
in my mid-30s. I think I'm still, like, a child. And so I assume, because he's in his mid-60s, he's probably thinking
Is
the same.
he?
Yeah.
No, he looks so good.
Yeah. Well, yeah, I think so too. I do.
Yeah. I wouldn't have pegged him as mid-60s, no way.
No, I mean, powerful, and he's been doing his craft for a really long time.
Wow.
Very talented. If anyone in the world can go see him, he really is a 12 out of 10 for what he can do. Yeah, and he can just, again, he's a medical intuitive as well. He can really see things. Yeah.
Yeah, I wonder if I message him tonight and see if I can go see him on Friday.
Remind me, and then I will message him as well, because he always gets... I told him about your case history, because I said, oh, can I practice on you? And he said, yeah, but probably better for him to do it. Because also, he can do something so much more.
Yeah.
Sorry, this is your hip here.
Okay. My hip is sore. Well, in that point.
Yeah. My hip is owie.
So sorry, he said it would be better for him.
Yeah, I mean, obviously,
Yeah.
like, I don't know to what extent I can do the work. Like,
Yeah,
I'm gonna just say,
yeah.
like, I can do like 15%, he can do 100%. Yeah, maybe especially with you not having to come into the workplace right now.
Yeah.
And this is quite important. Every time I've had a major life problem, health problem, I've gone to Ian and he sorted me out.
Oh, when I had that issue, I remember, I'm not sure if you remember, but with my hip, I couldn't lift it. It was like femoral nerve compression or whatever. And honestly, one session with him, after I'd been seeing this other practitioner for months and months and months, I got nowhere. Had one day with him. He's incredible.
Well, yeah, he's developed his own thing, so he really knows how to. And he does healing, osteo.
That one.
Yeah, that's your lower back, your lumbar spine. Yeah, I mean, I was not able to walk properly and he got me walking again. I don't even think of my hip. I had my nose broken and the NHS just forgot my referral, so then I had to have my nose. I didn't know what to do, so I asked him to fix my nose. It was very painful. So no one would ever know my nose was broken. And then when I had my stroke, I went to him first, and you'd never think I had a stroke. So
Yeah.
I mean, all serious problems.
Very serious.
Oh, thank you, Dr. Ian. I really appreciate it. Actually made a joke the other day because his surname's McTeer, right?
Yeah.
So I posted on my Instagram, getting trained by Dr. McTeer, and someone's like, yeah, he gives you lots of tears, doesn't he? Because sometimes it's very painful what he has to do. Yeah.
Yep. That's definitely like a 6 or a 7 in there.
Tight. This is hormones. Actually, if I can be very specific, this is your fallopian tube. So psychically, I'm getting that your pelvic floor is out and actually is creating a compression on your ovaries and tubes. So you might have some, I'm going to use the word problems, but you're going to have some difficulty with period. You might not be aware of it. Like maybe like blood doesn't flow as well. You might have a bit of like old blood come through from the last cycle. I don't know if that is happening. Where it starts a bit, I guess old, you know?
Yeah.
Brown, old. Residue. There'll be some residue because I can feel the tube is clogged.
Wow.
Or blocked because of your postural imbalance. It's really nice I can talk to you on the go because so much comes up in a session.
Yeah.
And then at the end of the session I was like, what can I remember?
There'll be one day where you'll be talking and I'll just be out cold.
Yes. Abracadabra, baby. Does this hurt or no?
No.
You need to do the red light. I swear to God, it's 12 out of 10. I've done 3 sessions last week.
Yeah.
And I can just feel the blood in my body is just doing really well. And I'm alert. And I would say as well for your fluids, it will really move them.
Okay.
And I think your leg size would shrink as well. I just don't know where around. I don't know if you could come to where I go in Beckenham. I don't know if it's too far.
That might be a bit too far.
I mean, I'm sure they're popping up everywhere.
They do them, you'll hate this, at the tanning shop.
Oh, really?
They've got new beds.
Oh, yeah. But they are red light, right?
They're proper red light. Well, I don't know if they're proper. I shouldn't say they're proper red light. They are red lights. So yeah, I think when I saw it, I can't remember, it was like 10 sessions or something for like 180 for an intro offer.
Oh, nice.
So maybe I should give it a go.
I think so, because like I say, I've done a few sessions and I can see my hair, my skin, my cognitive function, my sleep. And even because one of my health issues is I retain lots of fluids. And,
Yeah.
And so when I get off the bed, it's like a puddle of like fluids from head to toe left behind, and it's like, wow, this is just bringing out the bad stuff. So yeah, like when you say like, oh, you're looking a bit slimmer, I was like,
yeah,
I'm just a little bit less water retained, right? I'm actually a skinny bitch on the inside.
oh my gosh, you kill me. In a good way, in a good way.
Mamma mia, pizzeria.
That's tight up the top.
Yes, ma'am, your calf is
Yeah.
talking. Here.
Yeah, right in there. Yep.
I would still wear your compression socks, even though you don't feel, inverted commas, you need it.
Yeah, okay.
I would do that, and we need to up your fluids. But yeah, we do definitely a colonic soon.
Yes, please.
Definitely.
Before my partner kills me.
Okay.
No, actually, but...
This was so much better, surprisingly. I'd say your right leg, but that makes sense because it's taking all the slack, isn't it? But I would say compared to last time, this is a whole new feat.
But now maybe it's just like actually identifying like the real...
The root.
Yeah.
Definitely liver, spine. But spine is correctable and fixable. Like, for example, we can get you fluids, red light therapy, go to Ian.
Yeah.
Colonic. Your increased juicing, bone broth. Fluids where you can in your foods, lots of vegetables. Lungs, you're going to do breath work.
Yeah.
The limps in your feet don't present bad. And then, yeah, I don't know if there's anything. Exercise, you're not allowed to do exercise now at the moment.
I'm not really exercising, just walking everywhere, and even that can be a struggle sometimes.
Yeah. Don't know what. There's a new place a client has recommended, something called the Human Generator. It's a machine. It looks really cool. You lay in this like bed and it like treats you. But yeah, maybe I'm gonna go first try it out. But I think there's a lot of homework for here to do.
Yeah, I basically don't need another job.
This is another job. But it'll be good, even just to incorporate a few things just before the next session. Because then, like I said, we're going to do a course of 6 weeks is what I got last time. But it just in this one session difference, it's really made a difference. And if you incorporate these other bits and bobs, I think we're going to figure out your code. You know, we're going to decode your issue here. And most importantly, prevent it from happening again. Especially if it's the third time, because I appreciate it's very scary. I guess I have that same thing, like why did mine happen? But I put it down to I had to have an NDE, and I sort of checked out so I get some spiritual shift. Because ever since I came back, I was really a different person. And then all of this has happened. So there we go, my lovely.
Thank you so much.
I'd just like to end off this video with sending a very big thank you for taking the time out to watch this video. And I really hope it has helped you in a specific way, whether that's relaxation, education, awareness, or just really helping bring some calmness and stillness to the mind. And on that note, as this video ends, please can I ask if you can like and subscribe or even comment on how you felt about this video and if it helped you or if you learned something from it. And I'm sending you lots of love wherever you are in the world and inviting you to come back next week for another video. This is Star Friedenberg, empowering your mind and body through wellness consciously.